your annual OSHA Safety Training and Refresher course. OSHA stands for the Occupational Safety and Health Administration. They're the federally governed body that regulates how employers can work to ensure that you don't get sick or injured while on the job. Hi, I'm Beth. I am your K.Vet Animal Care Safety and Compliance Officer. You actually really need to know that in case OSHA ever shows up at the clinic for an inspection. So this video, we're going to dig into all of the safety rules and regulations that apply to you as an employee at K.Vet Animal Care. So hit pause, grab a drink, sit back, and pay attention. There will be a quiz at the end. We have the responsibility to provide you with as safe of a working environment as is possible, free from any serious, recognized threats. At the same time, you have the responsibility to abide by the safety rules, regulations, and measures in place to protect you and your fellow employees. Anytime that there's an accident or even a near miss, make sure that you report that to me, your safety officer, or your supervisor, or Wendy, the practice manager. Anytime there's an illness that happened while at work, anytime that you were injured, anytime that there was a near miss, maybe you noticed some tripping hazards that need to be fixed, or something electrical that needs to be repaired, always bring that to my attention. We'll do our best to make sure that we get that fixed in a timely and fast and efficient manner for you. That being said, you also have the right to report directly to OSHA. So if you come to me and you tell me that you have a problem and I don't do anything to address it and you still feel unsafe, you can report to OSHA. Their website is www.osha.com and report the incident anonymously. And there is no retribution at all anytime that you report to them. We cannot get you in trouble for bringing to light something that needs to have our attention. So in order to keep us compliant with OSHA regulations, we also have to ensure that you are following our safety rules. This is very important because if we don't come down on you and make you follow the rules, we can get in trouble with OSHA because that's not keeping you very safe, is it? So there are some rules and regulations we've all got to follow. Some of them are just plain simple common sense. Don't get hurt at work. How do you not get hurt at work? No horseplay. Don't go running around the hallways, slamming doors on people. Don't throw anything at or for or to anyone. Practical jokes are really fun, but if they are physical practical jokes, they're probably not very safe, especially not those ones where you're yanking a chair out from under somebody else's thumb. Aside from the medical prescriptions from your doctor, any drugs or alcohol on premises is strictly prohibited. That also means that you can't go out to the bar on your lunch break and get drunk and then come back to work. We do a lot of things that could be dangerous. We handle medications. We're trying to deal with stressed out animals. We are running lab work. All of these things can be difficult enough to stay safe, let alone when you are impaired at all. There are to be absolutely no weapons at work, ever. There's no need to bring a gun inside. There's no need to bring a knife inside. Yeah, we all know there's scalpel blades and things around, but you don't need to bring your own. This includes also nunchucks, missile launchers, and hand grenades too. This one's kind of the common sense of the common sense ones, right? If you're not crashing into things, you're not going to get hurt, chances are. So use the handrails when you're using the steps so that you don't slip and fall, or if you do, you can catch yourself. Take it easy around corners. At K.Vet, we have a lot of blind corners. We've also got doors that swing that don't have windows that are used by traffic going in both ways, in and out. So you want to make sure that you're taking it easy and taking it slow so that you're not running somebody else over or slipping on an object that might have just fallen on the floor before you walked around the corner. Electricity can be especially dangerous, so you want to make sure that you're being as careful as possible. We shouldn't ever have a need to use extension sets, especially on a regular basis. If on the off chance you have to use an extension set, make sure that it is absolutely turned off and unplugged from the wall at the end of the day. That means it's only in use when someone is around. Also, it should not be stretched across an area where people are going to be walking and therefore tripping over it. If you really absolutely have to, because we're dealing with some sort of a power emergency or something weird going on, make sure that that cord is taped to the floor so it's not going to be as much of a tripping hazard. If you notice any problems with any of the electrical outlets at all, whether they're not working, whether they seem to be smoking or how they get stained when they seem to be shorting out, anything weird, make sure that you report it to me for me to get fixed. Electricity can be especially dangerous. See, I feel like this probably needs to go unsaid. You need to wear footwear that not only is comfortable because you are on your feet and you're moving quickly all day long, but you've got to stay safe. Your soles need to be anti-skid. Your toes need to be closed and preferably not with mesh on the top. Some tennis shoes are mesh shoes. Also, no high heels. There's no need for that in a veterinary clinic. Hand washing is especially important in the veterinary clinic because we're handling dirty patients, laboratory specimens, and all sorts of things all day long. You should be washing your hands between every patient after handling laboratory supplies, before you go to break, before you go out for a smoke break, before you come in from a smoke, or after you come in from a smoke break, after you use the restroom. Wash your hands pretty much after or before you do just about anything in a veterinary clinic. We handle a lot of zoonotic pathogens and parasites that can infect you. Best thing you could do to help to prevent that is to wash your hands on a regular basis. Now, if you have not handled anything that is potentially infective or zoonotic, and your hands are not visibly dirty, it is acceptable to use hand sanitizer instead. Hand washing is especially important in the veterinary. When you're washing your hands, make sure that you are using warm, running water, adequate soap, and you're lathering that up and rinsing it well. Do you remember how long you're actually supposed to be scrubbing your hands for before you rinse them? Yep, that's right. 20 seconds at the minimum. That's singing happy birthday through approximately twice. Any areas where there is traffic, especially areas where there is fast moving traffic, and areas that are routes of exit in case of an emergency. It's really important to keep that floor and that area clear of all debris. That means no boxes or empty cardboard boxes. That means no garbage bags waiting to go outside. Take those directly outside. Because if someone pulls the fire alarm and everyone rushes to get out the door in one fell swoop, everyone's going to be tripping over debris hanging out in the hallway. So that means hallways, stairways, doorways. Also, keep in front of fire extinguishers clear because we're going to need to grab those in a hurry if we ever have a fire. Fire alarms, electrical panels, those should all be clear of debris. That includes any storage areas too. Bonus points if you can message me with who this person is and why this picture is on this slide. So, wet floors can definitely pose a slipping hazard. So anytime that you spill something on the floor or mop the floor, use a caution wet floor sign. We have multiple ones scattered throughout the clinic. If you don't have time to run and grab a wet floor sign because maybe it's a couple of rooms away and you just spilled something in the middle of the treatment room floor, grab a towel, grab a chair, something to put over that spot so that people can visualize that there's something going on there and they pay attention instead of walking right through it. Use caution while you're doing your evening cleanup because the floors are always going to be wet as you're doing your mopping. In the event that you do spill something, we do have a chemical spill kit that's located in the technician office under the desk. It's easy to grab and portable and has a detailed instruction sheet for what to use for each type of spill. You might have spilled something that's just water or maybe a beverage or some other regular household substance. You might have spilled something that's a chemical like cleaner or bleach or some other concentrate that requires special material to absorb it and get rid of it. Maybe it's a biological spill. Maybe it's an animal that you were performing a necropsy on with a suspected rabies case. There are appropriate absorbent materials for each need. By the way, biological spill also includes any time that a person cuts themselves and bleeds all over the place. I'm not talking about just the little bleed that requires a Band-Aid or, a bandage wrap till they can get to the doctor. But sometimes in veterinary medicine, we have some big accidents. And if that happens, somebody needs to clean up after you while you go to the emergency room. Be safe when you have to climb up and reach anything on a top shelf or a shelf that you just can't reach. We do have step ladders that are placed all over the hospital. Grab a step ladder and use it properly. It should be fully and completely open. You should never stand on the absolute top step and use that handrail to hang on to help to maintain your balance. All drinks must be kept in specially approved areas like the break room or your nook where all of the cubbies and your mailboxes are. Everything, no matter where it is, should always have a lid on it and a straw that can be covered so that there's never any chance that any airborne pathogens or chemicals can splash down into your drink. Drinks are always strictly prohibited in the treatment area, the surgery prep area, the examination rooms, and pharmacy. If someone does hurt themselves, you are absolutely not required to provide first aid of any sort to either an employee or a client. Best thing you can do is help them help themselves and get them to MedExpress or the ER. If you need to tend to an injury of your own of any sort, the self-aid kit is located in the treatment room in the upper cabinet all the way down on the right end next to the radiology room. Included are bandages and slings and eye wash and antibacterial ointment and antimicrobial wipes, all sorts of things that you're going to need for you to provide first aid. There's nothing major in there. If you have anything bigger than what that kit can handle, you need to go to the doctor's office. If you get something in your eye, we have multiple eye wash stations located throughout the clinic. One is in the laboratory. One is in the laundry room at the laundry room tub, and one is at the surgery scrub sink in the hallway outside of surgery prep. Anytime that you are injured or become ill as a result of your job here at K.Vet, and by ill, I mean something that you've contracted because of your job description, not because of maybe the cold that's going around the office, right? Anytime you get sick or injured, make sure that you report it to me immediately and always seek medical attention when you need to. Forms to report are located in the technician office in the filing cabinet top drawer all the way up in the front. You fill out the OSHA injury report, OSHA Form 301, each time and return that promptly to me. There will be an investigation to make sure that we're doing everything we can to prevent this from happening in the future. Maybe we might add in some retraining for you. Maybe we might add training for the staff in general or implement products or procedures that can help us stay safer better in the future. Also, take the MedExpress and Script Share forms, which are the authorization forms that you need to go with you to the doctor when you receive treatment. If there is a human bloodborne exposure, there are additional forms located in the same file folder that must be filled out and taken with you to the doctor. You also have the option to fill out a medical history form that includes things like your vaccination status, your medical history, and your HIV or hepatitis status. This form is kept in a sealed envelope in a locked safe, but will be sent with you in the event that you have to go with first responders to the emergency room so that they know best how to take care of you. As an employee, you have the right to know what hazards are present in the workplace, including chemical hazards, and how and what you need to do to protect yourself from them. This means that we must provide information and training on any of the chemicals that we have on site at the practice. Now, in this instance, OSHA considers anything chemical or hazardous to be just about everything. Any of the liquid medications and a lot of the pill form of medications count. Any cleaners, any solvents, any anesthesias, all of these things are considered hazardous chemicals. Even the cleaning products that you typically have at your home that you use on the regular basis, when they're in a work environment, are considered hazardous chemicals. We must also keep a current list of any of these chemicals that are present in the hospital. And we need to give you access to the safety data sheets, or SDSs. These are the sheets that come with each chemical from the manufacturer that detail any of the pertinent health information, safety information, what to do if you get it in your eye, environmental toxicity, toxicology, all of the things, yada, yada, yada. We give you access to all of those too. We must also provide you with the personal protective equipment that you have to wear to keep yourself safe from these chemicals. And we must provide you with properly labeled containers. This means that anytime anything is transferred out of its original container into a secondary container, it must be properly labeled with all of the important information. That we must provide. Secondary container labels often look a little something like this, and they must identify the chemical. They must identify all warnings that are pertinent to it, and must also show the hazard rating that comes with each chemical. Second, animal handling is a staple of our job, but make sure that you don't get so comfortable in restraining animals that you lose sight that these animals are stressed and often in pain and may lash out when we do scary or painful procedures. Make sure that anytime there is anything to note about a patient, notate it in the alerts section of their chart. This includes not only aggressive patients or patients who are fear biters, but also ones who may become fear biters in the future. Maybe a patient is better with mom and dad in the room. Maybe they're not. Maybe a patient prefers peanut butter. Maybe a patient prefers the dark radiology room with the door shut. Notate all of these things to make it easy on the staff in the future. Restraint devices are always provided and are always encouraged when you feel you need them. These include leashes. Every animal should get a K.Vet animal care slip lead before you bring it out of the exam room. We have muzzles properly fitted and all over the hospital. There are cat muzzles and cat bags and the net clamshell. We have a rabies catch pole if we need it. We have all sorts of restraint devices. We even have gloves that are bite resistant for those animals or those times that you absolutely have to handle one. Dogs and cats are different. So what might work with one species doesn't necessarily work with the other. So make sure that you know what you're working with and their typical behaviors and restraints that work well for them. Slow down and take your time. What works best for that pet? What is going to keep you and your teammates safe? Always be in control and at the ready. Don't forget your fear-free training either. Less is often more, but that doesn't mean that you can be lax in how you're holding a patient. Make sure that you are still there and ready to tighten down if an animal goes to lash out so that you can catch them before they get to you or your teammates. Always get help from your teammates when you feel like you need it. Anytime a patient has a past history, anytime you're not comfortable or an animal is showing signs that you should sense danger. We should never let our clients help to hold a patient during procedures because we don't want them to get hurt. Remember, in stressful situations, the patient doesn't always pay attention to who's holding them. They just know that they're scared and stressed and something just bit them on their shoulder when they got their vaccine. We see a lot of cases that are potentially infectious to the animal's peers, such as in the case of parvovirus or kennel cough or feline viral rhinotracheitis. But we also see a lot of potential cases that are zoonotic as well, meaning you can get them. Some of these are as bad as rabies. Some of them are as simple as a ringworm infection. That's why it's so important to always wash your hand after handling every patient. You never know who actually is positive for a certain disease. If someone comes in and their animal is showing suspicious symptoms that you suspect might be either infectious or zoonotic, a safe habit is to always treat it as though it is. If we've done our due diligence, we've used caution, and we've treated it as though it is an infectious case, when we find out that it isn't, everybody's safe and no harm, no foul. If we treated it as though it is not an infectious case and we relax in our handling of the animal, and then we find out that patient really did have this illness, now we're in trouble. Now we have to backpedal and clean up behind ourselves, and possibly other patients were exposed, the staff was probably exposed, and it turns out to be a big mess. So just treat everything as though it potentially is infective. That means that when you're handling anything that's potentially sick, always wear at the very least your face mask and a pair of gloves. If you suspect that an animal is possibly infectious or zoonotic, they need to come straight in the back door and straight to our isolation room. No, it's not an ideal exam room, but it's the best place for us to contain any type of disease, and it will keep the rest of the hospital and the rest of the pets and clients that see us much more safe. Anytime a pet's diagnosed, they definitely remain in isolation. That means the owner and only the owner can be the one to visit that pet. We keep a log of any time anyone goes in or out of that room. And they must also follow our PPE protocol, meaning when they go into the isolation room, owners must also wear a cap, a mask, a gown, gloves, and protective footwear. That way they're not tracking it all over outside of the isolation room once they go to leave. Anytime a necropsy is merited on a suspected case, actually, just use caution. Anytime you do a necropsy, handle it as though it's infective. That means it goes into a sealed room like the dental suite, not the surgical room, and doors closed and only necessary staff in the room to perform the procedure. Always wear your safety goggles, gloves, full gown, cap, and footwear. I've mentioned PPE, right? You're probably tired of hearing me say PPE. It's that important. You should always have it at the ready, and anytime you suspect anything, wear it. Anytime you handle anything that's dirty, anything that's infected, anything that is an open wound, wear your gloves. If you're flushing dirty ears out, put a mask on and put some goggles on for some extra protection. You really don't want Pseudomonas splashed into your eyeballs. When it comes to fire safety, the only people who should be heroes are the first responders. Use a fire extinguisher only if you're comfortable doing so and the fire is small. Your biggest concern is heading out the door after you scream fire and pulling that fire alarm on your way out. Grab clients with you as you go to help them out of the building too. meet back at the dumpsters behind the building. You're going to report to me, to Wendy, to Brittany, or to Dr. Coniger to make sure that we do a head count and have bodies that go along with all of the cars that are in the parking lot. Don't rush in to go get an animal after you have left the building. First responders don't want to have to spend their time rescuing both the animal and you. They want to just worry about going in, rescuing the animals, and putting the fire out. If you're going to use a fire extinguisher, make sure that the fire is small. Place yourself between the fire and an exit route. That means don't put yourself in a corner with the fire between you and the door. Our fire extinguishers at K.Vet are located all around the hospital, including at the front desk by the door that goes between the reception area and the treatment area, in the treatment and laboratory area next to the vaccination fridge, and back at the break room in the doorway that goes to the eastern hallway. When you use a fire extinguisher, you only have to remember the acronym PASS. These are the steps that you follow to make it work. You're going to pull the pin out of the handle. You can't push on the handle if the pin is in the way. So that one's kind of self-explanatory and foolproof. You're going to aim the nozzle at the base of the fire. The base of the fire is where everything is actually burning. The flames are just kind of like icing on the cake. Squeeze the trigger and sweep back and forth along the base of the fire. We are constantly training staff and offering extra materials that can help you avoid workplace violence and stay safe when it comes to people problems, right? We touch throughout the year on a variety of topics that include things like de-escalation tactics, how to communicate with people, including clients, and how to deliver bad news. We've even done active shooter training where we have had an officer come in and do a live drill with us. When it comes to avoiding violent or unwanted behavior on your part, just remember to be a good human. It's that simple. Don't steal anything. Don't damage someone else's property intentionally. Don't sexually harass or molest anyone. Don't mouth off to clients or to your fellow staff. Don't cause harm to another person. Don't intentionally do anything negative or unkind. Anytime that you do anything that can be deemed an act of violence, this is cause for immediate termination on your part. This goes both ways as well. We don't accept violence as an alternative from our clients either. We don't accept any harassment or derogatory comments from our clients. So they also may be subject to being fired just like you can be. That being said, sometimes we have to offer them a little bit of grace. It goes a long way to remember that your clients are under a lot of stress. Their baby is coming to you because they are sick or dying, and probably that client is under a lot of financial strain. Stress bubbles to the surface in those cases and often comes out as them yelling at you or not necessarily being nice to you. There's a big difference between somebody just being mean or really going over the top versus them having an emotional outbreak, right? So anytime that anything happens, make sure that you fill out the Violence Act form that is also located in the tech office in the top filing drawer towards the front, and let us know. We will look into all acts that you deem are unsafe. This goes both for your safety. We also have implemented some additional safety practices and procedures. All of our outside doors are locked at all times. You must use your passcode or be buzzed in order to come in. There is a panic button located at the reception desk right next to the cash box in the center of the aisleway. Our parking lots are well lit. we have pepper spray. Yeah, I know I said no weapons on property, and pepper spray can be considered a weapon, but it's a defensive weapon. So there is pepper spray located at the front reception desk and hanging inside the doorway to the doctor's office. No one walks out the door alone at night. Everyone must leave with a partner. For your safety, we also have implemented, in addition to this major annual training course, you are also trained annually pursuant to topics that pertain to you. So that means that you may have to take animal handling skills course, stay up to date on your fear-free training, take a radiation safety and techniques course, practice anesthesia safety course, and ethylene oxide safety course. This concludes your annual OSHA safety training and refresher course. This course must be completed every year in order for us to comply with OSHA standards and for you to remember how to stay safe and to learn new practices and procedures and policies that have been implemented. Please, if you have any questions about anything or if you want to learn more, make sure that you visit the OSHA website at www.osha.gov or message me, call me, or see me at work.